But anyway, just to catch up, why I'm doing all this. The reason is because, we have a lot of people who actually come back to me and say, hey, it's really a foot problem, really having an issue in diabetes. And I was surprised. Also, people are asking me for even pre-diabetic. So I said, wow, that must be a much more issue than I must have thought, because at first I said, well, maybe just diabetes is a problem. But actually pre-diabetic, a lot of them started a problem first. The scene of pre-diabetic is the very dry skin and also lower extremity. And on top of that, as time goes on, I noticed their bottom of the foot is also less sensitive because the nerve is starting getting not function as well, as slowly degenerated because of the blood sugar issue. So really at the end of the day is not only pre-diabetic or not only diabetes, but also pre-diabetic also affected. So today's seminar will be very important to a lot of the people who really are diabetic, pre-diabetic. They really have to watch our foot, okay? Hi, I'm Angela, Lowsutea President. 嗱，點解我今日係做一個堂咧，講講糖尿病或者前期患病者對腳係點解咁大影響咧？咁我好多人以為唔會啊，因為我而家前期患病啊，點解能夠對我腳都有影響咧？咁其實咧就呢個唔係嘅，真係會有影響嘅。咁同埋咧，我有好多經驗做深切治療嘅時候，護士咧亦都睇到好多經驗咧，有好多人前期患病同埋後期患病咧都有咁嘅問題嘅，即係糖尿病者或者前期患病者。So 呢個係一個要重視嘅。So today's webinar I think will be very helpful for lots of people who really have not have the experience yet, and you gotta really alert yourself. You gotta take care of foot. So just to give you an update why I'm so passionate to talk about this issue. I'll give you two examples. One, when I was a nurse in St. Francis Hospital ICU, one of the Japanese lady came in. She's so kind lady and very, very nice, heart loving, very good person, good personality. And she was only doing her yard work at a very simple twigs, one of the little twigs from the yard put into her, toe area, okay? And it got infected. And that area infected because she is a diabetes and just didn't get well. Eventually, she at first cut off all the toes in that area because it become gangrene. And as time goes on, it still don't get well. Eventually, she lost entire foot before it stopped. So she never able to recover to do yard work anymore because she have no foot. One foot is gone. And I have another experience with Mrs. Fong, which is another very good lady, which I worked with her for 6 months in the same hospital. Imagine she in and out ICU for 6 months. That's a terrible experience. But the sad part is Mrs. Fong is the same thing. She lost her foot, first of all, then she lost second foot, and so on and so on. As time goes on, she lost both sides of the foot up to the, just on the leg. But she has stopped breathing 4 times and her heart stopped. I revived her 3 times. And eventually, the last time she was ready to go home, the 4th time, as 11 something, her heart stopped. And the thing is that before I left her, I said, Mrs. Fong, you're going home. Congratulations. I hope you do well. And I said, what else I can do for you? She said, I'm having a back pain. So I did. I gave her a back pain. And next thing I know, while going for a report, she stopped. Her heart stopped, and her stopped breathing. And I CPR her for 45 minutes because I was so desperate. I said, you gotta live, you're going home tomorrow. And unfortunately, I could not revive her. And that touched my heart for all these years. This 40 years ago, imagine that, 40-something years ago, it still touched my heart. So that's why I said, doing your pre-diabetic is so important. 各位同學嗱，其實點解我咁要講 即係呢啲咁嘅即係堂咧，俾你大家即係分享咧。個原因咧就係因為我喺做護士嘅時候咧，喺深切治療護士咧有好多病人咧係因為小事，第一個係日本嘅婆婆啦，佢就係只係一個細嘅即係啲木枝啦喺個花園嗰度拮到自己，咁腳唔好要斬咗隻腳趾公啊，其實斬晒去 ，eventually 成隻腳都冇埋，就係因為佢有 Gangrene。咁變咗嚟講咧，一個好慘嘅佢做唔到啊，即係永遠都唔會做花園嘅東西，佢冇一腳啊嘛。另一個係方太咧，我救佢4次，又係同樣嘅問題。咁但係咧，即係我救咗4次，最後一次咧，我係用咗45分鐘救佢唔到嘅。咁所以變咗嚟講咧，喺呢個糖尿病嘅腳咧，真係唔可以即係唔重視嘅。同埋仲有一樣嘢咧，就唔係話淨係有糖尿病先係嘅，前期患者又咁今日咧。我哋希望大家俾多啲資料咧，大家可能夠研究到一樣嘢。So today I'm going to start giving you the webinar now and make sure that you get all the information, so that way you can have a real good insight what I'm talking about diabetic, foot problem and pre-diabetic. So everybody can see this. I presume you guys can see these slides, so that will be very good. And so, but I have a lot of new guys coming here. I have people from Singapore, Malaysia, Hong Kong, United States. I have also from California, Vancouver. So I have a lot of people. So what I would do is I just give 5 minutes just to go through a very basic thing so everybody can understand what I'm talking about, why we're going to, so that people catch up. Now, first of all, you got to remember, if you have diabetes, sad part is you will never get well. You will always not get well. Can people Facebook and see all my slides? I hope they do. Can no slides? Okay. Okay, hold on. Can people Facebook and see all my slides? I hope they do. Okay. Can no slides? Okay. Okay, hold on. Okay, let me see. I can okay, let me see. Hold on. Okay, I'm getting some technical advice, okay? Okay, I'm getting the Facebook slides out, and so give me a couple minutes. Okay, now you guys should have seen the Facebook Live now. And then let's see, I can do this. Okay, let's see. You see the slides again? Can we see the slides? Okay, you got it. You guys see the slides. Okay, you guys got it, right? Eugene, can you give me a 2 if you see it in Facebook slides? Okay. Can Eugene tell me whether you got Facebook? I think you should be able to see it now. Hold on. Can you get Fernando? Okay, hold on. I'm sorry for the technical issue. I'm getting my staff to help me out on the Lowsutea forwarding, and it should be there because I saw it in Lowsutea now in live. Can you get him? It's very quick. I know. Can you help him? Make sure you get him once you call me. Okay. Okay. Why don't I start moving forward first? And because what happened is maybe there was some forwarding issue. Can people go inside to see if you can get there in Facebook with Lowsutea? Is it the Lowsutea slides? I think that's where we were. Lowsutea. Lowsutea. You can see because we are on Lowsutea live right now. So you can do that. Probably we can see it. Lowsutea. Because that's where I'm broadcasting on live on Lowsutea. Okay, you can do that. But anyway, let me just spend a couple minutes to talk about the diabetes first. Sorry about for the technical issue we have on the Facebook. But nevertheless, first of all, as you know, diabetes will never get well. All they can do is control. And in order to control, you have to control your diet, exercise, and weight management. And with that, you have to drop your A1C to at least 6.4. If you don't do that, it will be an issue. Okay, so really at the end of the day, you have to continue to monitor yourself and finish, get the control. Now, certainly in the dieting, it's so important to drink Lowsutea because that is a property actually does work. If you have pre-diabetic, the sad part is you have no medication, doesn't help you. So you really cannot help you to become a better blood sugar level because they have no medication. So dieting with Lowsutea definitely help you to lower because later on I'll show you why it works. So anyway, with that, you have to, in the dieting also, you cannot to eat any kind of white powder food, which is like flour, rice, and or very limited, no sugar drink like soda and so forth. Now, secondly, is the thing is how you become diabetes. Basically, it's very simple. When your cholesterol goes up, it blocks all damaging the pancreas B cells. Sugar do the same thing, so they break down the B cells, not able to carry the sugar into the cells. So it continues goes up with cholesterol and sugar, your blood becomes thick, and we're going to form plaque on your vessels. Net result of that, you're going to increase your blood pressure. Now, third, as you don't do anything, your lifestyle is the same. The sad part, as we move on, your blood sugar will continue to go up. Your A1C will also go up. Net result, you become pre-diabetic. And last but not least, in 3 years, you don't do anything, you eventually become a diabetic person. Now, why Lowsutea work is because we have a guava leaf that blocks sugar into the vessels. Bitter melon actually have carry the sugar into the cells. And on top of that, bitter melon has a good, one more item is excellent, is helping you to lower your blood sugar by dumping the sugar and also salt and cholesterol through the urine. So net result with that and all that, you will lower your blood sugar, cholesterol, salt. So a lot of people drink Lowsutea actually lower the swell on the ankle. Now you don't do anything. The sad part is you might have chances to increase your stroke, cataract, pancreas malfunction, heart problem, nerve damage, high blood pressure, and potential amputation, which we'll talk a lot more about that. A lot of people also become kidney failure, so they have diabetic nephropathy, and certainly 30% of diabetic patients have no sex function. They fuck sex function because of nerve damage. So naturally, also pregnancy can be an issue because you have potential become diabetic during the time of pregnancy, and you can later on recurrent pregnancy with diabetes. Now, for Lowsutea, our plan is basically help you to decrease the blood sugar So the pre-diabetic patient will postpone their conversion, and they will have less chances to get complication with 5 programs. Our program will be including training Lowsutea, low carb diet, teaching you how to do that, exercise, weight control, and certainly right now we're talking about doctor webinar and also blood tracking. So net result, all that toward to your healthy blood sugar level, and that's what we're trying to do. Where patients now already have A1C 10% lower to a 5.7% or see it with own eyes, cervical feel like that, and extremely good. So thank you for giving the time, allow me to catch up. And now I'm going to go to my normal lecture right now. Now, actually, it's really interesting. Pre-diabetic, type 2 diabetic is a common thing to even type 2 or pre-diabetic. Foot problem is a very common thing. Now, a lot of people don't talk about it because they might not aware, but to be honest, they will definitely get this because of the fact that, you know, this is really going to be a problem that people can always see, you know, in their, how should I say, in their common occurrence, if they're pre-diabetic, if they're type 2 diabetic, having foot problem is continue to be a potential issue for you. So what you gotta do is you have to really take care of foot. You have to manage your blood sugar to decrease that risk. So make sure your foot can be healthy. Now, this webinar will give you an insight, but the insight you have to act on because you cannot just not act on. Okay？ 嗱，各位堂友，好多糖尿病者或者前期患病者咧，佢哋係真係會覺得哇，糖尿病咧係會對佢個腳咧係好有問題嘅。呢個係好多人都知道嘅。OK？ 但係咧個問題咧，即係好多人都知道呢樣嘢啦。咁但係好多人嘅問題咧，就係唔知道咧，你係可以控制到呢個唔會發生。如果你控制到個糖，所以好重要咧，就係你哋個個人都要做嘢咧，係控制個糖降低。咁你唔會令到你自己咧係踏入咗呢個即係嘅風險裏邊啦。By the way, thanks Eugene. Thank you for advising me that you already see the Facebook broadcasting of Lowsutea. That's perfect. Thank you again. So important. You really have to take care of your foot by lower your blood sugar, plus all the additional stuff that I will teach you today to not only just the dieting and all that, but you actually have to do quite a few more items to ensure your foot is good. And I can tell you why, because later on I'll show you, you will able to actually see a lot of these things can be really not just diet, because you can be a corn, could be dry skin, can do the same damage. So we'll talk about it later, okay? Okay, so where the area, how come your foot will be affected, okay? Usually, I said, I'm diabetic or pre-diabetic, why my foot are being affected, okay? Let's go through the rationale. Now, if you are pre-diabetic or you are diabetic, you have the major problem first to start off is nerve damage. It's called diabetic neuropathy, okay? 嗱，各位堂友，你話喂，我糖尿病啫喎，點解我會有令到我哋嘅腳有問題咧？其實好重要，第一樣嘢好多人唔知道咧，原來當你係前期患病者或者糖尿患病者，第一樣嘢咧，你嗰啲血嘅所有嘅神經係會開始有損壞。咁如果啲神經有損壞嘅時候咧，你其實係感覺唔到咧，好多嘢咧開始壞咧，你唔知嘅，因為咧好多時咧，你依啲地方啊、腳趾公啊、腳個底啊，你都冇咗感覺，開始有傷口啊壞，你睇唔到，因為冇咗感覺。OK， so a lot of people don't realize as long as a pre-diabetic or diabetes, and I have a lot of customers who are pre-diabetic came back to me already. Say, Andrew, my foot don't feel that well. They cannot describe it. They said they feel the feeling. A lot of them will ask, it feels a little hard. But it's really hard. It's not really hard. It's basically they lessen the feeling here. Lessen the feeling here. So they said they feel hard. That was one of the common they have. So because of that, they have really start getting more and more nerve damage. Now they're only pre-diabetic, but they already got that feeling. Now certainly start off is not only immediately. There will be 1 year, 2nd year, 3rd year, more and more they feel that feeling coming around. So very important. This could be take 5-6 years, okay? And I noticed they will start feeling that which you really know that things are coming. So you need to take care of yourself. Now, if you truly become a little bit more and more, besides feeling hard, the next symptom is coming over. You're going to feel tingling feeling, a little bit pain, less feeling of feet, and you might not even feel the blister or cut or sore, the injury along the way. So you might not even get that. So net result of that, this is where your journey of your foot, okay? So really, you gotta start watching your foot, looking at it, and make sure understand what it is. Do not just ignore it because you will feel regret at the end of the day. 嗱，各位堂友，好多人以為喂前期患病啫喎，點解有依樣嘢㗎？或者糖尿病啫嘛，我隻腳點會 involve 咧？個問題就係因為你個神經系統咧開始一路損毀，咁個損壞程度咧係唔係幾個月嘅，係1年2年嘅，所以你感覺上可能你就會咗係哇好似好硬啊 feeling， 少少地，遲啲咧就會有個痛啦，或者有少少 tingling 嘅 feeling， 如果感覺震震地 tingling 嗰種 feeling 咧，咁然後或者感覺係越整越少。最後咧個問題咧就係當你冇咗感覺後咧，有可能你有個 pop 嘅鞋嘅 pop 喺呢個腳嗰度，或者一個細嘅 cut， 好似我日本太太淨係一支小嘅枝插咗入去，佢感覺唔到發炎，咁咧就會全隻 end up 咧呢個發炎咧控制唔到咧，咁就變咗 Gangrene。咁其實咧。我喺右手邊嘅頭圖咧睇咗啦，第一，當你感覺嘅時候咧就會有痛啦，開始有啲 blister 啦，有 numbness 啦，即係冇感受咁多啦。然後好多時咧仲有 deformity 咧個改變嘅個 shape 啦，咁同埋咧仲有個 ulcer 出現啦，即係有啲即係個 pock 啊紅腫啦，最後咧個腳就壞咗就叫 gangrene 啦 ，OK？ 咁所以變咗呢個係開始一度落嚟咧，係有一個慢慢咁出嚟嘅呢個咁嘅現象嘅。個原因點解隻腳會死就係啲血去唔到啦，已經啲血管啊全部塞住晒，同埋咧將嗰啲 nerve 全部 damage。咁所以咧係糖尿病隻腳咧係一個好大嘅問題嘅。So in this chart, I show you right here why I took a little more longer time to explain. Because a lot of time when our foot, we never see ourselves on the bottom to have an ulcer, to have a blister, especially a blister are broken. And then next thing you know, there will be a ulcer or you'll be a sore. And eventually this is going to be your major problem. The progression of the problem, reducing blood supply, which is called ischemia to your foot, is basically first you have tingling feeling, not a little bit pain, and then eventually we have little callus, and then you have numbness, and some of them you get deformed, meaning the foot will change shape, and then ulcer formation will be formed, and then eventually you have gangrene. So really at the end of the day, this is the progression. Now, so if you really at the end of the day, you already start seeing yourself with pain, less feeling of fit, you really need to every day do the thing that later we'll talk about. You have to check your foot all the time. And you really want to wear shoes covering your foot, especially in Hawaii. People from Hawaii wear Japanese slippers. Maybe it might not be a good idea, like my Japanese elderly lady doing yard work. she didn't wear shoes. She was wearing slippers. And her slippers are little twigs that puncture into her toe that started all the infections. So that is a high risk for all of us. So you got to be very cautious in that sense. And I felt bad for her because of that, she got infected. So important for diabetes or pre-diabetic patient at home or going out or going travel, always wear cover shoes because of the fact that you don't know what environment you have can able to injure your foot. So you always should cover yourself also with the socks maybe. So give cushion to the foot. So these are a few things that later on we'll talk about. But very important, imagine this is your major problems can start off and can be a potential very problem for you. 所以各位朋友，如果你係前期患病者或者後期患病者，即係糖尿病啦，咁你真係要好小心咧，唔好唔着鞋有蓋嘅鞋，冚住腳，同埋咧要或者着襪，令到佢腳唔會咁容易創傷。因為創傷咗咧，好唔好嘅時候咧，你就好大問題㗎啦。所以呢樣嘢咧，千祈唔好喺屋企，就算屋企啊，唔好就咁着日本拖鞋，有腳趾突晒出嚟嗰啲，要將啲鞋個蓋啊冚住佢，咁你就能夠令到你唔會容易有腳損壞撞到，咁你就唔會有發炎嘅機會。呢個係一個好重要嘅影響嘅。So I hope this will give you alertness, at least you understand what I'm talking about. Now, when your circulation becomes very poor to your foot will become extremely poor circulation and start dying off. And this dying off is called gangrene, my friend. And gangrene, there's few gangrene starting off is one, if they're really dying off, if they are wet, moist gangrene, it definitely have very foul smelling, like some dead rats next to you, and that will be the case. I saw a lot of the ICU patients who have that eventually have the foot cut off here or cut off up here because the problem is the circulation to the foot, to the sore are so bad it doesn't heal, and the healing actually stopped because all those areas is dead. Then the doctor will have to, no choice, cut out a foot, usually cut off way up here. So the circulation is there enough where actually there will be healing process started. So keep that in mind. If your foot is start getting in the surface start turning blue, dark black, man, you are in good bad shape. You better fastly go to see a doctor, see what can do. Usually start off is a reddish color, which is mean infected. You need to already probably get very big antibiotic to help you out before you get down to the black blue issue, because I actually saw these before many times. And so you need to treat it fast. Could be 2 to 3 days can turn a very significant infection. So you need to get that control very quickly. 嗱，各位朋友，好重要咧，當你血液咧唔係去到呢啲底下嗰度咧，由總紅色一路轉藍色，然後轉黑色咧，你好大問題，即係話已經隻腳咧係已經死咗喺嗰度。咁你血液唔到咧，咁你就變咗咧就會呢個變咗 gangrene 啦，即係一個死咗嘅冇血液循環，即係死咗嘅結果。咁死咗嘅結果咧，重點咧就係當你呢啲死咗嘅時候咧，個醫生就一定會鋸咗成隻腳去到啲地方能夠俾血循環去好。如果唔係咧，你個成身呢啲帶動咗全身嘅發炎咧就好弊啦。所以變咗嚟講咧，係一個如果你開始一有手受傷，佢變1-2日嘅啫，咁你就要快脆咧，要見醫生，俾好啲大嘅 antibiotic 咧幫你醫治呢樣嘢。呢個係一個好重點嘅東西 ，OK？ So everybody has to be really cautious the infection, because if you don't, you really in a sense could be endanger your own life, because infection don't heal, it will spread everywhere, it spread everywhere. You know what? You're going to have septicemia, you know, where the whole body become bacteria, travel everywhere, and you might be threatening your own health. So very important why the doctor will actually, if your gangrene don't heal, and they will end up your foot actually cut up as high as here, this person, all the way up to the highs and to the nearby the ankle area. The reason is if your foot don't get well, they cut off here higher, they don't well, they're higher, they go well, they got higher, eventually cut down here. So that's how they usually do that, because it doesn't get well, it continues infected. They will infect your entire body. So prevent the infection spread entire body, which is threatening your life. Then they have to keep cutting until you get well, so you can actually places they can able to control the infection. 嗱，各位同學，點解個醫生咁殘忍㗎？第一割咗我隻腳，然後就一路再割上去，割到我差唔多去膝頭哥咁遠。咁點解㗎？其實咧個原因咧就係因為嗰啲血液循環好差，佢隻腳係唔會好，唔會好咧，佢就一定要割咗你隻腳，然後一路割上去，割到嗰笪地方佢真係會好啦。因為如果唔係咧，你個發炎咧係會繼續全身去走。如果全身去走嘅時候咧，你就弊家伙啦，因為可能咧去到好多地方咧，你係醫唔好嘅，咁你就會係即係俾死亡嘅。因為你發炎發得好緊要啊嘛，咁所以變咗嚟講，呢個係即係所有 gangrene 嘅人咧都有咁嘅情況發生嘅。咁呢個咧係一定你每個人都注重啊。So very important when you see a major infection, you gotta be very quickly get hold of a doctor. Now I know people in the United States they will say I can't get a doctor appointment. You better quickly to beg your doctor, I really need to see you because I have a severe infection. Squeeze me in. Don't let the delay to say, oh, I can maybe wait for my appointment, because you cannot be wait. I'll give you one example. Even a doctor can also make the same similar mistake. I shouldn't say a mistake, but a decision delay. I have a patient long time ago who actually have an injury to the foot and it was infected. But the doctor said, well, maybe I can go for a culture, find out what kind of infection before I give the right antibiotic. And the matter of that time is only 4 days. But delayed antibiotic, this patient actually got into severe septicemia problem because of that 4 days only. 4 days, imagine that. And this patient is severe, very sick. And it's really, at the end of the day, we end up with no patient to treat. That's really sad, because imagine because of just delayed antibiotic can be very serious. So do not delay. If you have a patient that, or you have yourself or friends, whoever, if you have a severe infection because he is pre-diabetic, diabetes, you call your doctor and bug them to give you that appointment. Don't let it delay for your appointment. 嗱，各位朋友，我知各位堂友咧，好多時打俾醫生，醫生話冇 appointment 喎，冇時間喎。咁你快脆即係重視你啊！我係糖尿病者啊，我唔見你唔得啊，因為咧我依家發炎發得好緊要，我一定要即刻俾你睇。如果唔係香港朋友啊，好快脆就係去急症室。因為急症室咧係能夠一定睇你㗎啦，因為政府醫生睇你㗎嘛。咁所以變咗最緊要好快有醫治嘅能力啦，同埋食呢個抗生素嘅能力，呢個係十分重要嘅。So very important, if you don't see the doctor immediately, very quickly, you need to basically maybe go to emergency, at least see a physician to get your culture and also get antibiotic to at least cover the infection, prevent the infection to spread further. Okay, so that is important. Now, so my question is, how do you keep your feet healthy if that's the case? Now we talk about if you're injured, it's great. You gotta get hold of that infection and don't let it get down to really get severe infection. That is so important. So that has been well discussed. Now the next step is, well, how do I keep my foot being healthy? 嗱，頭先講咗好多嘢咧，就話如果發炎即刻要醫啦，要食抗生素啦。咁但係依家如果未有事嘅時候，我點能夠令到我隻腳係繼續健康嘅咧？唔會有任何嘅問題咧？ So this is something that you should take a picture. I would suggest you take a picture so we can at least examine every single one. 嗱，各位朋友，唔該你或者用你嘅相機，或者你自己影張相，咁我哋可以逐個解釋要做啲乜嘢。So it's really good if you can take a picture so we can able to talk about it every single step. How do you actually take care of foot? Now, first step, very important. Every day you have to wash your foot, no doubt. And everybody know that. And everybody do that. I take shower, wash my foot, right? But washing your foot is only the first task. But you also have to dry your foot very, very well. Don't get moisture on the foot toe, between the toe. Those have to dry. And also, you have to feel your feet. Is it you have any bumps or temperature change? And important in this area, you feel the pulse of your foot, the blood circulating. You should able to feel that pulse. This is important. The two finger feeling the pulse. Do that every day. If you have no pulse, that's means your circulation become less and less poor. So you really need to do that and make sure that your foot is warm, good to touch. It's not all cold, no feeling. And then you have to look between all the toe in here, the toenail, make sure there's no damage, no skin that falling apart, no redness here, because a lot of time your athlete foot, that's where it grow. And that athlete foot item will actually get you to be more problem. Okay? 嗱，日常嘅腳嘅 actually 去 take care 你腳係好重要嘅。嗱，當然啦，好多人就話：哇，我每日都沖涼洗腳㗎啦。嗱，洗腳還洗腳，但係你洗得好唔好緊要。第一，你有冇用一個即係好嘅梘液啦？啲梘液嘅油嘅梘液咧洗咗腳啦，洗到乾乾淨淨啦，唔會洗到即係好多嘢。同埋有冇一個 sponge 去抹下隻腳，同埋 make sure 嗰啲唔好嘅 skin 係都離開咗啦。洗完腳之後有冇乾隻腳乾得好透啦？唔好俾啲濕嘢喺側邊個腳嘅腳趾甲裏邊咧乾咗佢啦。同埋每日咧你要感覺下依個 pulse 有冇一個血液嘅感覺，有個pulse 嘅有個腳嘅血管咧有冇感覺嘣嘣嘣咁咁咧？你可以撳落去咧就感覺到嘅。如果越整越冇咧，即係話你 circulation 越整越差嘅嚇。咁同埋係咪有冇依個即係隻腳變咗好凍啦？咁如果好凍，你就係要着翻啲襪啊，即係啲襪咧可能 increase 咗你 circulation 嘅。咁仲有咧要 look at 隻腳，所有腳趾架側邊咧係冇有紅腫嘅東西啦，好似香港腳嗰啲東西啦，呢個係好重要嘅。咁每日都要做喎，唔係話一個月做一次喎，呢個日日，因為你轉變咧係可以好快嘅。OK， so keep that in mind. The first 4 picture, you really have to do that every day. It's not something that you can just ignore, do it once a week or once a month. That's too far because the change can be very fast. Because a lot of people I noticed, especially people in Hong Kong or somewhere in the Philippines or Malaysia or Singapore, because the area are very moist. So you also have a chances very easy to get athlete foot, fungal growth. Those fungal growth can be an issue if you develop fungal growth, okay? So now when you cut your foot nail, toenail, you have to cut it straight. Don't cut deep into here. Because deep into here, you may potentially injure your foot without knowing. This cutting here, if you don't cut straight forward, you cut deep inside here, you have a potential basically to injure your foot because of cut. If you actually did do that, you make sure you're taking good care of it by putting betadine, disinfectant to make sure that area are not being disinfected. I have to take care of that wound real well, because if you don't, this is the area will start infected, you are in trouble. 嗱，各位堂友，當你剪腳甲嘅時候，一定要直剪入去，唔好剪側邊呢度咧，因為剪側邊呢度咧，可能真係令到你咧係會即係剪傷咗佢啊。咁當你剪傷咗佢嘅時候咧，好多時咧有問題咧就係咩咧？呢度開始發炎，咁啊成隻腳趾俾人斬咗去，咁就好弊家伙啦。咁所以咧，呢個係一個好重要嘅東西，千祈整腳甲咧係慢慢剪，唔係一剪到咁深咧，剪傷咗咧就弊啦。如果真係剪傷咗點算啊？即刻揾啲 betadine 啊、紅藥水啊、碘酒啊，搽翻佢，咁令到呢笪地方真係唔會發炎。呢個係好重要，好重要啊！記住。So if you get accidental cut, use betadine to make sure to take care of the wound. Now, then this is even more important because a lot of people don't even bother. I noticed, and when I talk to my customer, they or my clients, they should say, "Well, I don't really check that because check the dryness of the skin. Is there any crack over here? Is there any crack over here? Is there any crack over here? Any crack?" A lot of people don't really do it, don't even see. Dryness of your skin is really the first step they start getting infected, because the driest and be cracked, bacteria get in, then you get infected. That's where you're going to start getting a callus, a blister, a red, infected. So dryness is one area where you really has to take care. Now, very important to treat dryness is you have to put cream, actually foot cream, wax, Vaseline is the very important Vaseline, thick Vaseline, to help you to make sure your foot become also wax, smooth, and not totally dry. And that is so important to prevent infection. Because too dry, your skin is going to get easier injury, and that's where your infection can occur. So always use Vaseline, heavy wax to smooth out your skin. I know people in Hawaii, they wear slipper. They might say, well, I don't do this. But if your skin become dry, you really have to try to use Vaseline cream. Could be any brand, but really thick Vaseline to help you to do that. Okay, so that's important. 嗱，各位堂友，隻腳乾咧係一個好大問題嘅。咁點整乾唔乾佢啊？嗱，好多時咧，你去買啲 Vaseline 或者油啦，但係就唔好有濕嘅油啊，要乾，即係油係真係油嗰種，有 wax 嗰種，咁令到佢呢笪地方咧要好潤滑，唔會乾。咁你隻唔乾。唔會 crack 咧，個 chance for 你嘅發炎咧就會低咗好多嘅，所以一定要做到呢樣嘢為止 ，OK？ 咁仲有一樣嘢咧，就要每日咧係去用隻鏡喺個鏡睇下個腳板底有冇問題。So every day you really have to examine your foot. Now your both your feet, I can't see the bottom, so you need to have a mirror to check your bottom, and you check the bottom, especially your pinky toe, all these areas. A lot of people don't check, and a lot of time your infection are start in this area. Actually, this is the common area to start out, and that's where most of the people got into trouble, because these areas are so bad, they start doing it, get infected without knowing. It become worse. This is the really. You need a mirror to check every day. I know you said maybe humbug, but that is going to help you to save your foot, my friend. So let's try to do that, examine. If you have difficulty bending down, because some of my customers say, I cannot bend down, get your wife, your husband, your friend whoever work with you, try to work with them. Every day examine that. That will be do. 嗱，各位朋友，你揾個鏡要照底下隻腳，因為如果你唔照隻腳咧，你唔知底下發生咩事。因為最多問題咧就係呢啲咁嘅地方咧就會有發生你個紅腫嘅問題、crack 嘅問題、香港腳嘅問題。如果你唔醫咧，呢個就係地方開始咧係有發炎，發炎咗之後你唔知道咧，咁咧就弊家伙啦。因為好多糖友咧，當佢發炎開始嘅時候啊，係冇症狀痛，因為佢嗰啲 nerve 嗰啲神經系統已經破壞咗啊，所以佢未必感覺到嘅。所以變咗好少發炎呢度腫咗，佢都唔知喎，真係 OK。咁呢個係一個好大問題，所以一定要用隻腳嚟睇。Also alerted many of the diabetic or pre-diabetic patients, sometimes pre-diabetic will have the same problem. Because the nerve is already start damaging a bit, they don't get feeling in this area, so they cannot see. Even a blister established, they might not feel the pain. So they have no alertness, they don't know that it's infected. This is including my Japanese lady who got that problem. As really sad because that's where she started off here, infected without knowing, become so bad, her foot eventually cut off. Now, doing all that, you have to track and find out any problem, document it, so the doctor will know, wow, I have this, I infected 2 days ago, this is it, got worse, describe what happened, so people know what is your problem, okay? So a lot of the doctors will ask usually, well, when an infected established, when, what time? A lot of time you don't write down, we kind of forgot. I don't know, it's a few days ago, or I don't know. Then it's not going to be good. So once you examine every day, write down, then you can document right away. Oh, it started yesterday and I have this. So we can able to judge and give you antibiotic as soon as possible, whatever the treatment, you got to do that. Now, one of the things that actually also, one of the things that will be helping you to getting better at foot care is if you can able to do a warm foot soak every day will be good, because warm foot soak will help you to moisture and will help you to decrease the dryness of the skin. So put a little salt on the water, do a warm foot soak will make you feel a lot more comfortable, relaxed. And after you do all this, you can document you have done that too. So that will help you. 嗱，各位堂友，你一定要寫低係咪有地方發炎咧？如果冇就寫咗冇啦。如果有就快脆幾時發炎啦，幾時嘅樣子點啦，同埋寫翻個地方喺邊度啦，同埋仲要咧即係有幾大啊。當你見醫生係即刻話俾你聽，我前胸係發炎嘅，乜咁佢就會希望幫助你咧係會更加容易 treat 你。嗱，好重要咧，好多啲咁嘅 Callus 咧，好多啲嗰啲厚厚地 skin 咧係好單粒，一路整一路大嘅，所以呢個咧就真係要注意咧佢個發展如何啊。咁所以變咗喺個鏡嗰度睇出嚟咧，就 document 咗之後咧就好過你淨咩都唔知，幾時發生又唔知。So very important, the documentation, plus if you can able to soak your feet will be very good with the warm water, relax you and get a better foot health treatment. Now, remember, we have a corn, you know, what is a corn here? It's a corn here, callus, 一個厚嘅皮啦嚇 one of the thicker skin. Usually that can be a problem. Keep that in mind. So wearing shoes and socks all the time, protected feet from too cold, keep flowing back to your feet, moisture with wax from itchy, so you don't scratch it and break the skin, especially dry skin, especially people from colder places like people from Chicago, from Vancouver, especially wintertime or LA. These are the things that you will potentially get into trouble. So always wear socks to protect you, to help you not to get yourself into problem. So 各位朋友，嗱，你個腳咧有好多呢個即係 corns 咧，有啲係即係 雞眼啦，可以叫廣東話嘅雞眼啦。咁其實咧，呢啲咧一定要係着鞋啦，保護自己啦，仲要着襪啦，唔會俾佢凍啦。同埋揾啲 wax 咗腳啦，能夠令到佢唔會好乾啦，因為乾咧你會痕啦，你會拗啦，會拗損啦。呢個係一個要好小心 ，make sure 唔會令到腳會裂開啊啲咁嘢。So importantly, make sure that feet cannot be dry because dry you itch, you're going to scratch, and you're going to injure with a finger with a lot of bacteria. You just introduce the bacteria in your foot. So very important. Do not scratch your dry skin. I know we do that all the time, but if your skin will dry, very itchy, wax it. So prevent it from getting dry. So now, some of the corn, we talk about some of the things that we commonly also going to watch, and I have it here too. So can you actually take a picture of this also? That way we will know where the things you'll be pay attention. 各位朋友，我想俾多啲資料你咧，令到你每一笪地方嘅東西咧係要注重嘅同埋注意嘅。咁或者你而家可唔可以影一張相咧？咁我哋就可能夠繼續講呢樣嘢啦。So please take a picture because that will help you to identify the common problem, okay? First of all, number one, bunion and corn are very common for many diabetic people or pre-diabetic people because of your shoes rubbing the bunion. You will have continued injury, tend to be red. Eventually, the circulation become poor. You know what? You get infected. So this bunion here is always have that issue. So you gotta remember this bunion, make sure you're taking care of it, make sure you massage it, make sure it doesn't get infected. So if it is still start getting a little bit of redness, make sure your shoes doesn't continue to irritate that area. Wear shoes the bigger base so you don't continue to rub on this area. So very important, you need to protect yourself from this bunion injury so you can able to not to get infected. OK， 嗱，各位朋友，你每個女士、男士着鞋咧都有呢個骨走咗出嚟嘅。咁如果啲鞋成日頂住佢咧，好多時間咧你就會有發炎嘅情況發生啦。咁如果可以紅腫嘅時候咧，你就真係要做多嘢massage下佢啊，或者係用啲油啊捽下佢啊，令到佢唔會發炎啦，同埋最緊要隻鞋咧唔會太窄啦，令到繼續去 irritate 佢啊，呢個係好重要嘅。The second thing is callus. You know this callus here at the back of the heel of the foot is very important. You got to take care of that callus. A lot of people don't understand. If you are callus like that, the thin skin become very thick because of the pressure, because maybe due to your shoes, because of friction of your shoes, whatever, it create a crack. And this crack is where the bacteria go in, and that's where they get infections. So the callus, you got to really take care of this item, prevent it from getting callus. So in order for you to prevent that, you put heavy wax on those areas, the dry area, prevent them to get worse. A lot of time I found that you also warm water soak can be very helpful to help them to, increase healing with some salt on the warm water, and then massage it, and also with wax to make sure this area become moist, not moist, but more not dry, and smooth and not dry. Prevent it continue cracking bigger piece. 嗱，各位朋友，呢啲咁嘅枕咧就裂開咗咧就弊家伙啦，因為點解咧？佢就會有發炎啦，啲微菌入咗去啦。好重要咧就真係要點樣咧？係揾熱水啊，唔係熱水，即係暖水啦，加鹽落去啦，去浸下腳啊，同埋揾啲 wax 咧，去令到佢呢度好滑同 smooth， 唔會令到乾。咁呢個咧防止佢一路繼續裂咧。啲微菌入去咧，咁就好弊噶啦。咁呢個係好重要嘅 ，OK？ 咁仲有啦，隻腳咧 ，if the foot you have a lot of time has this kind of corn And these corn are very common. These corn are very common. I notice a lot of ladies, a lot of men also have it. That is one of the area is always because of that, due to infected because of the skin, had a lot of pressure from the shoes. So very important, this corn has to take care of it. Don't let it get infected. 嗱，雞眼咧係好大問題，因為隻腳咧可能因為對鞋唔好啦，個壓力大咧，令到佢有雞眼啦。咁呢個你可能要換咗對鞋啦，要 make sure 呢個雞眼唔會發炎啦，呢個好重要嘅。咁呢個咧係一個好多人都女士尤其是女士更加多見到嚇。So very important, you really have to take care of the corn, make sure it doesn't get infected, and is commonly in this have a lot of people have this issue here. And as mentioned, toenail is important. You cut off toenail, this is the time that a lot of people accidentally cut it, and that's the common infection area. And then dry skin is another one. This is common here too. Worst but not least is the ulcer, which I talked about earlier, pressure ulcer. All these areas, you really gotta soak the foot, make sure your cut nail is straightforward. This is wax, you can help. And make sure on your, also in your shoe, get good cushion. Make sure your shoes have a lot of absorbent cushion, and you have to wear socks. And if you have all these problems, you check, shape has changed, for example, you start losing feeling, you have an ulcer, and that means your blood circulation getting worse, and you start losing blood circulating in this area, and you really need to take care of it to get well. So wax, massage, increase circulation, wear comfortable shoes, start to develop corn, ulcer will become of the very important things you have to protect yourself. 嗱，各位朋友，頭先講咗啦，如果有雞眼啦，如果剪腳甲唔好啦，如果腳係乾得好緊，呢個係常見嘅乾嘅，一 crack 咗係㗎啦。咁仲有咧，呢啲係好嗰陣時咧有 ulcer 啦，咁呢啲 ulcer 咧就係一個腳嘅 pressure 啦，隻鞋唔好啦，咁你着嘅鞋一定要買啲好嘅鞋啦，有 cushion 嘅鞋啦，依家好多體育鞋都好正啦，有個叫 air cushion 啦，能夠令到個 impact 唔大啦。咁呢啲係全部咧幫助。咁仲有一樣嘢咧，如果你可以每晚用啲鹽水去浸下隻腳啊，令到腳係更加舒服，暖啲鹽水啦，同埋 make sure 你搽好多油啦，令到腳乾咧，咁你咧就 most 嚟嘅情況上咧都唔會有咁大嘅問題。So very important, you can able to do that will be perfect. So besides daily food care, again, reminded everyone has to take care, drinking Lowsutea, dieting with low blood sugar, you have to exercise, better circulation, weight control, improve your circulation. And last but not least, you got to quit smoking if you're a smoker, because smoking does worsen your blood flow to your feet. So make sure you do that. Now you notice this lady keep feeling her pulse here to see whether her circulation is good. Okay, so this is one way to check the circulation. So 各位朋友最重要啦，最後唔係淨係 take care 隻腳啦，好重要就係你繼續要用你個 low 低血碳水化合物嘅食物咧，去幫助你自己唔會整高你糖啦，同埋要諗去糖茶啦，仲有咧要做 exercise 咧，每日要做好多運動啦。當你糖係降低佢啦，因為運動就可以降低，用咗啲糖去降低啦。要你磅去即係控制你嘅體重啦，同埋咧如果食煙就唔好食煙啦。呢個食煙咧係因為可能夠令到你腳嘅血液咧循環低嘅。So in conclusion, as a pre-diabetic or diabetic person, the major problem is nerve damage. That is the major problem. So if you have nerve damage, you might not feel it, you can hurt it, your foot, then guess what? Your foot will get infected. Especially lower extremities, the sensation become low, end up your foot will not feel any injury, you get infection, you don't know, you might end up with a leg amputation. That would be very sad. So importantly is you have to have all these day care, make sure the foot got dry, examine the foot every day, continue to lower your blood sugar, and basically by exercising, drink Lowsutea diet, low carb diet, weight control, track your blood sugar, make sure that it doesn't go up high all the time. Not smoking will be very, very important. If you can able to do that, your risk of getting your foot being amputated is much lower than other people don't take care of foot. Okay? 各位同學，即係在 in summary 啦，第一唔係淨係糖尿病者，多仲要加埋前期患病者，都係同樣咧，要將你嘅腳咧係慢慢每日去整理好，等佢又唔好有繼續會有咩問題壞嘅。個原因咧就係因為當你係前期患病或者係糖尿患病者咧，你首先最大問題咧，你神經系統咧已經開始損壞。當你損壞嘅時候咧，你係冇咗感覺，冇咗感覺嘅時候咧，任何一個損壞嘅撞到嘅腳啊，你唔知道咧，發現咗都唔知道嘅。咁越整越係咧，嗰啲血液循環唔到咧，咁你隻腳咧就會開始繼續壞死。咁最後咧，醫生就要斬咗你隻腳，咁就真係好慘啦。所以其實咧好重要咧，每日你就要將你嘅腳咧係真係要 take care 嘅。要睇下佢有冇損毀啦，有冇雞眼啦，有冇發炎啦，有冇一個 blister 啦，有瘡啦。咁你能夠當佢抹沙佢啊、腳啊嗰啲係好重要嘅。咁仲要咧，每日咧要繼續咧係飲去糖茶啦，你個 diet 啦，碳水化合物降低啦，就要仲要去 exercise 啦，去運動啦，因為運動係降低血糖噶嘛。咁仲有咧就 weight control 啦，你磅數降低啦，咁同埋每日咧去即係睇下你個血嘅糖係咪仲係好高，咁你要控制你血糖咧，咁希望咧呢啲所有做嘅東西咧都唔會令到你咧係會失咗你嘅腳，即係風險裏邊，即係唔會俾你令到你即係斬咗腳嘅風險啦。咁如果你係食煙嘅，就千祈唔好食啦，食煙係會令到佢血糖咧落去隻腳係少咗嘅。So I hope this webinar will help you, provide you a good insight how important you take care of foot. Especially we have a lot of people from Hawaii from our webinar. A lot of people will just wear Japanese slippers walking all around if they're diabetes and no, that is not a good idea. Actually, you got to wear shoes with cover, even at home or also outside. Buy a shoes, maybe for example, Crocs may be a good idea. At least cover your foot so you don't get accidental injury, even at home. So that would be my suggestion, because I myself also buy Crocs, so I don't inside a slipper, but I just wear a slipper will expose all my foot in case I have injury my at home or at the yard or wherever. So just keep practicing that. I hope we can keep our foot healthy. And today is my webinar. I wonder any questions from your end. If you have questions, I'd love to answer this stage. I really appreciate all my friends here on their busy weekend still listen to the webinar to update the information. And that will be really good. One question from Eugene from Hawaii. He said, when should I go to urgent care versus go to ER? Where do I take my foot pulse? And do you recommend a compression socks? So let me answer one question at a time. First of all, this is where you feel your pulse. Can you see that here? You feel this over here has a little pulse of boom, boom, boom. That's where you feel a pulse. Now, and you can go to emergency is like, for example, I started getting a redness in my foot. And it is not painful because I can feel it because you are diabetic, don't forget your nerves are being damaged. So many times you might not feel the pain, but it's getting red, it's getting swelled up. That's the time you gotta go to see your doctors. Now you might see a doctor, you say, oh, I don't give you an appointment until a week from now. Wow, then you have to monitor, is this infection get worse? It's not getting worse, it's not getting better, it got red, and the doctor refused to see you. That's the time you might want to go to see emergency to make sure that is being taken care of. 3 to 4 days getting ER. It might be a better approach. If the doctor don't want to give you like 3 or 4 days, the doctor still don't want to see you. Because I know some of the places might difficult to get doctor appointment. 所以其實如果你糖友問咗咧，幾時應該去急症室啊？如果醫生2、3盒都冇俾你 appointment 你咧，然後隻腳又紅又腫咧，未必痛，但紅腫咧，咁你就真係可能要去見個急症室。所以呢個係一個睇下你個發炎發得幾多啊 ？OK？ So importantly, a lot of people say, well, it's not painful. It just swelled up. Does it mean that I'm not getting bad? The important, you have to ask yourself, because you are diabetic or you are pre-diabetic, your feeling of pain is not much there because your nerves are damaged. So you might only feel, or you might only see is red and swell up. Might have no pain because you are not going to feel the pain because of nerve damage. So that is a very critical distinction, that your infection might be bad, but you don't feel it, so you don't get the urgency. So when it becomes dark red, especially, you better quickly go to emergency to look at if the doctor don't give you an appointment. It swell up and so forth, you still need to push the doctor to give you, quickly see you so you can get antibiotic to lower your infection. Okay, so that will be my answer. And I talk about the pulse feeling here. Do you recommend compression socks? Now, certainly if you have compression socks, the socks is okay. That's good because you basically press more circulation to lower. But you don't have that, a thicker cushion socks with a good absorptions of your, pressure of your foot. That will be good actually. So that way, you'll be able to prevent the pressure from your shoes. So wearing socks at home or going outside is very important. So buying a thick socks can be also helpful. 襪咧其實咧好嘅，因為襪咧係能夠防止你嗰啲腳嘅第一損壞啦，或者創傷啦。第二咧，如果你着咗襪咧，你着鞋咧都有個保護性同埋有個 cushion 啊，咁令到你腳咧唔會咁容易咧係有好多壓力啊。咁呢個係重要嘅。咁如果你買襪咧，買厚啲襪啦，但係一定要索汗嘅襪喎，唔好揀啲襪咧唔索汗就唔 good 嘅喎。So your socks should be also absorb your moisture of your foot. Don't buy the sock doesn't give you any moisture and you're going to be very wet because they don't absorb moisture. That's no good. So cotton socks are very good. So is gout related diabetic bunion? Actually, gout is different thing. As you know, gout is not necessarily a bunion. Bunion is actually really created by pressure of your foot usually, not by gout, okay? And gout is total different things. Usually the toe becomes swell up, it's reddish color, but it's not really the bunion. So that is not something that related to the, as we just talked about the bunion situation. Usually that is due to your shoes irritation. Excuse me. Importantly, if you have bunion, make sure you buy shoes don't continue to irritate. You buy wider space shoes, that will be good. 嗱，如果尿酸咧同呢個臏人咧係有少少唔同嘅，一個腳眼啊， 同嘅，因為腳眼嗰個咧係因為你係啲鞋嘅即係irritate 嘅鞋咧，所以會令到咁。OK，so 呢個我希望大家即係都 answer 到你大家各位嘅問題。So it was really good. I appreciate all the wonderful answer. Eugene is always a very good question asking person. I appreciate that, Eugene. You are really my star. A lot of my friends also asked the question after the meeting, and really good that you asked forward that I can able to answer a question that's even better. So I'm sure everybody has the same, have a similar thought, need to ask a similar questions. So it was really good. So I appreciate your time. Thank you very much for your busy Saturday weekend. You continue to listen to the webinar to improve your knowledge. We changed our format a little bit. This time we're going to have a very detailed webinar. And next time, what we're going to have is going to have cooking and some very short information to alert you. And then we're going to have another one, which is mainly a very shorter information. So will not be as detailed, but is read to the point. So you have got a lot of good idea. And then will be one area we will so our format a little bit, make it more fun, enjoyable. So that way you can able to have a lot more variety. That's what my future webinar is going to be. So hope that you can continue to join us, learn your message, and maybe hopefully you can able to continue to be healthy. Thank you very much, and I appreciate your time spending with us. This is Andrew Lau signing off. Thank you very much. 多謝各位參與，希望各位身體健康。拜拜。